This is right in the middle of nowhere. The people who live here are the Maasai, and they have successively lost their land, they've successively lost their property. The people now have endured so much malnutrition over repeated droughts, over repeated famines, that they're very vulnerable. So a large number of the people here die in early infancy. A lot of the mothers die in childbirth because they're anemic. So the kind of problems they've got are very easily sorted. The only difficulty is no one bothers to sort them. The Ministry of Health is already overwhelmed. Its hospitals are full of HIV patients, 3-4 to a bed in many wards. So the nomadic groups, the nomadic tribes, are very neglected. The conditions that people live in are very extreme. And in order to preserve their way of life and their culture, it's important for us to be able to provide basic healthcare. And basic healthcare costs next to nothing. So Lorngosua is where we built Joe Barnes' clinic. Joe Barnes is an Irish doctor living in Dublin, but he spent many years in Africa. We named this clinic after Joe. And the reason we did that is Joe spent much of his life in rural Africa, working for free in disaster areas and war-torn areas of leprosy and Biafra. And we felt that this was the right place to put a clinic for Joe. And this is no palace, but it's here, and it's open, and it's working.